the left ventricle and is very, very big. So this animal has a severe left atrial enlargement, and the valves are also abnormal, and as I've shown you in here, there is a massive leak coming out of this valve, and I'll play the videos for you in a second. So this patient had mitral valve dysplasia. The valve, he was born with a faulty valve, and it was a huge leak, and then over time the heart activated compensatory mechanisms that make the heart bigger and bigger and bigger until the point that the patient went into heart failure. Short axis view of the heart. This is so in here what you do is the heart is like this, you cut it like a sausage and you look at it from the front, from the top. So the aorta is here, and this is the left atrium, and the left atrium shouldn't be bigger than 1.5 times the aorta, so you can see that this left atrium is more than twice the aorta, so that proves very severe dilatation. I'll play the videos so you can at least see a few seconds of this. See this big leak there? So how about in right-sided congestive heart failure? Well, right-sided congestive heart failure, we say gives you caritary effusions, and the most common is abdominal effusion. Now, some patients would also do pleural effusion as right-sided congestive heart failure, Now, there is a difference here, and I left it for later, try to not confuse you. So, in dogs, left-sided heart failure accumulate fluid inside the lungs, in the lung parenchyma, breathing difficulties. Right-sided heart failure, you accumulate fluid in the body cavities. Abdominal effusion is the most common. Some patients will also do pleural effusion, perhaps a bit less common. Dog. Now, if you're a cat with right-sided congestive heart failure can also, the same as dog, have the abdominal effusion and the pleural effusion. A cat with left congestive heart failure, which is the most common type of congestive heart failure in the cat, can have pulmonary edema, but also pleural effusion. So cats with left-sided congestive heart failure can also have pleural effusion. That's a different. Dogs, pleural effusion is in the right side type of congestive heart failure. In cats, it's on the left and on the right category, And this is just due to anatomical differences of the drainage of the pleural vessels into the right-sided or the left-sided chamber. So it's just an anatomical difference. But it's just to make you aware of it. So when you have right-sided congestive heart failure, you can identify that very easily with an abdominal ultrasound, because you just see fluid, black, on the tummy. You might also be able to identify fluid on the chest with a quick heart scan. If you do a chest radiograph on a patient with pleural effusion, what you see is a whiteout, because on radiographs, air is black, fluid is white. So pleural effusion will not let you see the air, you will only see white. This is the whiteout type of abnormality. So this will be an example. This is a cat, a chest right lateral chest radiograph of a cat. You can't see much, isn't it? It's like a whiteout. This is a cat that had hypertrophic cardiomyopathy and congestive heart failure and had developed pleural effusion. I do not know if he also had pulmonary edema or not. The fluid doesn't let me see the lungs. In cats that present like this, sometimes it can be more useful to just do a very quick, fast T scan. So a fast scan is just when you very quickly put the probe on the chest. So in here, I explained before I play the videos in case of work, I'll do it with an elbow, might be easier. This is the heart muscle. So this is the left ventricle pumping there, and all around it black is fluid. And here, this is the heart, this is the left atrium, left ventricle, right atrium, right ventricle, and this is fluid around the heart. And this is the abdomen, this is the liver, this is the caudal vena cava, which is very big, distended hepatic veins, and this is free fluid inside the abdomen. Let's see if this one wants to work. This works, very slow, but this one wants to work. So see, this is the heart pumping, this is the left ventricle there, the right ventricle was at the top, and this, there you go. See, this is another heart there with some fluid around. So, as a key point is ultrasonography is very useful for the diagnosis of right-sided congestive heart failure, but just remember, cats with left-sided congestive heart failure can also have pleural effusion. And then there are other tests. Let's see, you've got just over there. Yeah, I've got 2 slides left, we make it. There are other tests. ECG, we'll talk at length about ECG after the break. You can also do some general bloods, because when the heart doesn't work well, eventually can affect the function of other organs. And a very important one here is the kidney. You can end up with patients that, as a consequence of poor cardiac output, use of diuretics, use of drugs to block the RAS system, the renin-angiotensin aldosterone, you end up actually causing some degree of renal disease. Or by using diuretics, you make the kidney to just flush out all the electrolytes, potassium, sodium, and this patient might end up with weakness on the muscles, or in cats, ventral flexion of the head, because they lose too many electrolytes. So that's why patients with congestive heart failure, especially once they are in medication, you need to keep an eye doing routine bloods to check the renal function and the electrolytes. These will be the most important ones. Urine analysis is the same. Ideally, you want to know the renal function of a patient that suffers from heart disease, especially if you can before it goes into failure, because if you identify that there is a pre-existing renal disease, you know that when the doc goes into heart failure, you might have some extra problems there. Some patients with chronic heart disease can have some mild anemia. That doesn't seem to affect too much to the overall survival time, but just be aware of that. And it's just anemia of chronic disease. And in some patients, especially cats, older cats with hypertrophic cardiomyopathy, and in dogs with dilated cardiomyopathy, you want to check the thyroid hormones. The thyroid hormones have massive effects in the heart. So cats with hyperthyroidism, too much production adenomas of the thyroid gland, too much production of thyroid hormone, that can affect directly the cardiovascular function. It can cause arrhythmias, it can cause hypertension, and it can cause hypertrophic cardiomyopathy, thickened muscle. So you might see a cat that you think is all cardiac, primary cardiac, but it turns out that it's hyperthyroidism. So by treating the hyperthyroidism, things get better. So that's why it's very important to check the thyroid hormones, especially in older cats. Dogs with a weak heart muscle, dilated cardiomyopathy, it might be that it's the heart muscle's fault, but it might be that they don't have enough thyroid hormones. Hypothyroidism can actually cause arrhythmias and a weak muscle. So that's, again, is important. Blood pressure, absolutely. This is very important. We've already mentioned it, and you'll probably be instructed into the different methods you can use, the Doppler, the oscillometric. I won't go too much into this just now, but again, patients with heart disease, you need to monitor that the blood pressure is kept under control, because the treatment you use for the heart disease will have effects on the blood pressure. And also, a patient with an acute presentation, if they present with low blood pressure, they are in more trouble than if they maintain an adequate blood pressure. And finally, you might have, especially old cats with primary hypertension, that eventually that can lead to heart disease. By treating the blood pressure, you might make the heart better. Yeah, so that's why, again, this is very important. And as we said before, sometimes you need to do respiratory tests, because you might have, especially old doggies that have both respiratory disease and heart disease together at the same time, and makes your life very difficult. I'll just leave you with a couple of pictures here for the blood pressure monitoring. So this is an old cat, and it's having the blood pressure being checked on the front leg, also on the tail. And the last slide, the biomarkers. I just said that we very, very briefly mentioned. Biomarkers are, or cardiac biomarkers, I should say, these are tests that you do. These two are blood tests that they tell you if something is going wrong with the heart or not. The troponin is indicative of cardiomyocyte cell death. It's something that lives inside the cardiomyocytes. So if it's high on the blood, that means that the cardiomyocytes are dead and they broke and the contents came into the circulation. So they're indicative of acute heart disease, myocarditis, myocardial infarct. Yeah? Pro-BNP is different. It tells you about heart being dilated, stretching of the heart. Yeah. When do you do these ones? Well, in my case, for example, I have patients that come for a cardiac workup. They've made an appointment to come and see me for having a heart scan, blood pressure, ECG, and sometimes a chest radiograph. It's no point for me doing this test. I'm already going to look at the heart. But you might find a situation like in first opinion, there is a dog, is coughing a bit, finances are limited, and you say, well, it's got a tiny murmur, but you know, it might also have tracheal collapse. I don't know if it might be a respiratory condition. I can hear some crackles, and you're unsure if it could be cardiac or respiratory, but the owner is a bit indecisive, or they can't afford a referral, or they want some reassurance before they go ahead and do some tests. In this case, NT-proBNP is a useful diagnostic tool to have. It's a blood test. Take the blood, send it to the lab, wait for a few days, so you can do that in an emergency situation, obviously. When the result comes back, if it's very low, the dog is likely to be coughing because of a respiratory condition. Then you can reassure the owner and say, well, for a respiratory condition, we can try response to treatment or try diagnostics. This is what we will be doing. If the test comes back as very high, it's like, oops, we are likely to be dealing with a heart condition here, a significant one. Therefore, we should consider this or this. It's more to help you reassure the owner what is the next step to take. Yeah? So we don't do them as a routine. They are useful. You just need to know when to use them. I think that's our break. Yes. Wow, you did very well. Thank you very much, because I think I touched a little bit from the hour. Do you want to have like a 15-minute break?